Greetings, ladies and gentlemen. After a long, cold winter, the House Health Subcommittee is back in business. So we will, pardon me.
She's got to get your gavel real quick.
Oh, don't worry about it. I've got a pen. It's no big deal. So we've got a quorum. I've been notified, and we will gavel this into session. So, Madam Clerk, I don't need a gavel. Don't worry about that. Just call the roll. Please call the roll.
Representative Boyd, Representative Byrd, Representative Freeman, Representative Hall,
Here.
Representative Jernigan, Representative Kumar, Representative March, Representative Sherrill, Representative Smith, Representative Terry. Chairman Ramsey, you have a quorum.
Thank you, Madam Clerk. We have some new faces in here today, no new members, but we want to welcome Rajul Bajet, our new attorney, and we want to welcome back Matt King, has come over from the Senate to illuminate us in some form. We want to thank our Sergeant at Arms, Johnny McDonald. We appreciate you being here. We have Addison Gross as our clerk, back there in the corner, and I think that's it. At the risk of violating any HIPAA laws, I would like to inquire of you: has anybody had any strange symptoms, scratchy nose or anything like that? I guess not. So does anybody have any personal orders? We see none. I would like to say Happy New Year to everybody, and glad our attendance is up from last year. So we will start with our calendar, and I think we have welcome Chairman Board. We have quite a lengthy calendar, but most of these items have been taken off notice. We'll go with them. I think items 1.
Yes, sir.
Okay. Item 1, House Bill 184, a fantastic piece of legislation, but it has been taken off notice. No objection. We'll take that off notice. Item 2, House Bill 449 by Hodges. We will take that off notice. No objections. Oh, this number 2 is going to be rolled to the final calendar. Number 3, House Bill 1355 by Curcio has been taken off notice. Item 4, House Bill 1262 by Hodges is likewise taken off notice. Number 5, House Bill 1539 by Weaver has been taken off notice. Number 6, House Bill 137 gladly has not been taken off notice, and we will take that up, and you're recognized, Leader Hawk. We have a proper motion and second on the bill, and my understanding is that it has an amendment that makes the bill. So to get in the proper posture, we will ask for a motion and second on the amendment. We have proper motion and second on the amendment. If you would like to discuss the amendment with us.
Thank you, Chairman and members. The amendment drafting code 011300, just to ensure we're the same. And this is similar language to what the Senate passed last year. We ran out of time in session last year to create just a simple reporting mechanism where Department of Human Services is going to report to an existing report what they're doing with TANF in terms of dollars spent to what purpose of TANF. So simply done, it's something we've talked about for a while, and gives us a report that we can utilize, Chairman and members.
Okay. With that understanding, do we have any questions on the amendment? If not, we'll be voting to put the amendment on the bill. All those in favor say aye. Any opposition? So approved. So we're back on the bill as amended. There has been some discussion on it, certainly not from I guess, a position of opposition, but we're fortunate today to have Marcia McShane and Taylor Aleph from the Department of Human Services, and we've had some lengthy discussions about this bill. The understanding was that the information that you have asked for came from a special committee, I think, that you and Dr. Terry served on and had requested, and that information is handed out to the appropriate recipients from the Department of Human Services. However, it is not. They do not include the separate 4 categories. And what the discussion, the direction that it went when I had spoken to them was that they have done a fabulous job in the 2 years of the pandemic. They've had large issues, expanded contracts, programs. They have dealt with a quadrupling of applications. And since August, several of the programs have been altered and deleted or have reached their end. And they are expecting us to have some constituent questions that might have to do with that, because we're still getting applications for programs that in a sense do not exist. And I think your committee had dealt with those timelines. So I had asked them to be available, and if there are no objections, I wanted them just to give us answer a couple of questions about where this program is going, so that we will be informed. And I think these are issues that weren't brought up in their presentation to the full committee, but we're going to have some questions pop up, and so this is certainly not in opposition in any way. So if there are no objections, we'll go out of session and recognize the Assistant Commissioner, Marcia McShane and Suzanne Carr, or Marcia, that'll be fine. We're out of session. And when we discussed the issues in here, last year we passed a TANF Opportunity Act, and that's in the process of going forward. And the statute demands that TANF funds will be used for the initiative. As such, it will include in the reporting requirements that we see reflected in this bill. And what I'd like to ask of you is, can you give us a brief update on the TANF Opportunity Act?
Sure, I'd be happy to. And we did do a thorough presentation in front of the full House. I'm not going to bore y'all with all of that again. I'll be brief. But we have awarded planning grants to 17 different collaborative groups that are led by a lead organization that fits into one of the categories. Again, there's lots of detailed information on the website, and I'd be happy to follow up in an email to anyone that wants to read more about that. They are in their 90-day planning process at this point, so that is coming to an end. After the planning process is complete, they will have their full proposal put together for the 3-year pilots. Those will go over 3 years and can be funded up to $25,000 each. So we are in that planning phase right now.
And in our responses to what you expect is to be a number of constituents that find themselves applying for something that doesn't exist, what's to come in this act?
Sure. Well, some of the pandemic funding that has ended, it doesn't directly relate to TANF, so I just want to clarify that. For example, we had child care assistance for essential workers, and that ran through the end of August. That took our standard number of applications from about 14,000, or not applications, excuse me, families served, from about 14,000 a year to about 60,000 a year. So we had a big uptick in the number of customers. Those individuals who didn't normally receive child care assistance received it for, almost that 2-year period. That's something that families get used to receiving, and then they get comfortable with whatever child care facility they have their child at. For that reason, when that ended, the pandemic-related benefits ended, we did definitely have a significant increase in the number of our Smart Steps application. That's our regular child care assistance. That has caused a backlog that we are working on. We're working with an outside contractor, hustling through those as quickly as we can. We sent all of you talking points previously, and again, we'll be happy to send those again to help you navigate any questions you have, and you're always welcome to reach out to us about that as well.
And I would ask, I appreciate that. The act, of course, relates to the planning grants that you mentioned, those planning grants, and it's my understanding in our discussion that those groups have been selected, and I would ask which groups were selected for planning grants and which parts of the state will be involved in that.
Sure. I briefly mentioned earlier there were 17 planning grantees. Again, that's not just 17 organizations. It's collaborative groups of multiple organizations. The whole idea is to get as broad a reach as possible, and doing that usually involves a combination of groups that can collaborate and try to, again, have the broadest, not only geographical reach, but also goods, benefits, and services reach. So in doing that, again, we had 17 selected. There are 4 in West Tennessee. I will be happy to provide the specific names. I'm just trying not to duplicate here too much, guys. But the focus areas from at least the abstracts, and again, we're waiting for the full proposal, is going to advance the TANF goals in ways that support fatherhood and child support interventions. Agape Child and Family Services, Family Matters, West Tennessee Healthcare Foundation, and the University of Memphis are the grantees in West Tennessee. In Middle Tennessee, we have Family Affairs Ministries, Martha O'Brien Center, Goodwill Industries of Middle Tennessee, Upper Cumberland Human Resource Agency, and Persevere. In East Tennessee, City of Chattanooga, First Things First, Knoxville Community Development Corporation, United Way of Greater Knoxville, First Tennessee Developmental District. And then we have a couple statewide grantees, Boys and Girls Club, Tennessee Alliance for Legal Services, East Tennessee Human Resource Agency. And the good news is, with all of these folks, so far we have reach into every county in the state. So we're very happy about that, because we want to emphasize, reaching not just Nashville and Memphis and Knoxville, but getting into those rural communities and making sure that these initiatives do what benefits the individual and unique community the best.
Okay, appreciate that very much. Anybody have any questions of the testimony? If none, I thank you so much for filling us in on that.
Sure.
And we will go back into session.
Thank you very much.
And Leader Hawk, you're recognized.
Thank you, Chairman. And just to expand a bit on what Ms. McShane said, it has been a very thorough, transparent process that we, Chairman Terry and Senator Watson, Senator Ockberry, have been the legislative delegates on this advisory council, and it's been a very transparent process working with DHS to get that out. This bill just adds to that transparency and creates another reporting mechanism to continue to give the legislative body and Tennesseans information that we need.
And I would ask, the 4 categories, are they listed in the bill?
They're listed throughout both federal and state code. They're not specified other than just to say the four purposes of TANF is listed in the amendment.
Okay. Further comments or questions? I will say that there was some discrepancy because of the time frame with the Senate. We will let the Senate worry about making that minor technical adjustment. And so if there are no more questions or comments, we will be calling for a vote to send this on to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman, members, so much.
Thank you. We'll move on to item 7. We have a proper motion and second on the bill. I think we have an amendment that makes the bill, so I would ask for, have a proper motion and second on the amendment. 5662, I believe. 5562. Is that what you have, Colonel?
Mr. Chairman, I don't have the amendment. Okay, the amendment makes the bill, excuse me.
Yeah.
Okay, good, I don't have a separate amendment.
Started me
Oh,
worrying there.
excuse me, I have 5562, yeah,
Yeah.
that makes the bill. First time up this year,
No,
okay?
okay.
Relearning.
You're recognized on the amendment. Well, let's go ahead and put the amendment on the bill. Any opposition to voting on the amendment? If none, we'll be voting. All those in favor of amending the bill as stated, say aye. Any opposition? So approved. We're back on the bill as amended. You're welcome to describe the bill.
Okay, thank you, Mr. Chairman and committee. House Bill 959 will allow Tennessee to join in the process of forming an interstate compact, allowing licensed professional counselors to practice in all states that join the compact. This will remove the need for counselors to obtain a separate license in each state in which they want to practice. Received a letter and shared it with the chairman from the Assistant Secretary of Defense, and I'd like just to read a small portion of that. This interstate compact alleviates licensing issues affecting our service members and their families and is considered by the Department of Defense top 10 personnel and readiness issues facing our soldiers and service members. The compact is constitutionally authorized, legally binding document between states. This compact is the same form as the nurse licensure compact, the EMS compact that we're currently under, the physical therapy compact, and the interstate medical licensure compact. Why should Tennessee join this compact? A few benefits include increasing job opportunities for professional counselors, supporting military spouse relocation and education, enhanced mobility for licensed counselors, and all especially important to our state, which is currently short of mental health providers. What the compact does not do, there's no significant physical impact on our state or licensing board. The compact enhances the authority of the state to protect the public and properly regulate the profession and leaves state-specific licensure requirements in place. And with that, Mr. Chairman, I renew my motion.
If nobody's got questions, yes, Speaker Marsh.
Thank you, Mr. Chairman. I noticed in here that it said after 10 states have adopted this. Where are we in that? Is that already been done?
You're recognized.
I'm not familiar where we are yet on this, but this will give our state the opportunity to participate in that process to become part of that compact.
And if they get a license that's U.S.-wide, will Tennessee not get the money that they're getting now for the ones that we license here in Tennessee?
Chairman Whitson.
Again, are you talking about, will we require a fee to practice here in Tennessee? I'm not sure on that, Mr. Chairman. I'll have to check on that and get back to you.
Thank you.
And I think Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman. And as I understand, Chairman Whitson, the compact just is enabling legislation. And please correct me if I'm wrong, or legal can correct me if I'm wrong. The way this works is our licensure agreements would stay in place as far as Tennessee, but it would enable someone that lives, let's say, in Huntland, Tennessee, to go across the line if Alabama is participating as a compact member, and that license would be honored in Alabama. But as I understand, Mr. Sponsor of the bill, every state to participate has to pass this identical legislation. There can't be any amended versions, and so that we're guaranteeing the quality of the licensure to be the same in every state. Is that your understanding, sir?
Chairman Whitson.
Yes, Representative Smith, that's a good question. I'm glad you brought that up. If you watch the testimony in the Senate, this was also addressed, and the Senate testimony and the sponsor of that says this By joining the compact, we do not give up our authority and requirements for the state of Tennessee. This will not override any state regulation or statute if we enter into this compact. And if a state violates this compact, they can be removed if they do not follow those standards as established.
Sure. Further comments or questions? I think it would illuminate us quite a bit. Chairman Byrd had mentioned to me that actually the state has 5 of these in place already for medicine, nursing, and such. And of course, this is one of the bills that we're going to be seeing for the next decade, that the changes were approached during the pandemic out of necessity, and we're just trying to build on that for the future. Coach Byrd had said that that this actually exists with teaching programs, and he thought this was a wonderful way to move forward. One interesting thing that I did find out was, now, is this bill going to government ops?
Right, and there are also, Mr. Chairman, there will be a part of the sunset cycle also will be addressed when the final approval of the compact is made by the state.
And one interesting thing that popped up was, even though it goes to government operations, when the rulemaking is accomplished, it will not. That these compacts are allowed to make rules outside of government operations, which is
right. They have to follow the rules.
Yeah, it's appropriate.
Excuse me.
Yes, it's appropriate. So I thought that was a very interesting process. So any further questions or comments? We appreciate you bringing this bill. As all great legislation that you bring to us. So we will be, yes, sir.
And Speaker Marsh, I will get that information for you right away on how much and what the requirements are for paying for any kind of new license in the state.
Okay, further comments, questions? If not, no objections. We'll be voting to send this to full committee. All those in favor say aye. Any opposition? So approved.
Thank you, committee.
Thank you, sir. I would like to say before we adjourn here. Oh, we have another one? Yeah, 1073. Oh, I'm sorry. Item 8, House Bill 1073 by Gillespie has been taken off notice. Would like to mention today we had a doctor of the day, and unfortunately he had to whisk his wife to the emergency room, but I'm sure she's in excellent hands. His name is, let's see. Pardon? Oh, his name is Dr. A.J. Reed Finlayson. A.J. Reed Finlayson. And his hometown is in Nashville. His specialty is addiction psychiatry, education and training, University of Ontario, psychiatry residence, McMaster University, and addiction medicine in McMaster University. So we appreciate him extending himself even though he had some emergencies and couldn't be here. So we have further comments, questions? If not, I will stand for a motion to adjourn.